Hi, everyone. My name is Nikita Kiran Singh, and I am a PGY2 in internal medicine. I will be presenting a case called transfusion-related acute lung injury, or TRALI, versus transfusion-associated circulatory overload, or TACO, in a 21-year-old woman with sickle cell disease. I was supervised by Dr. Shazia Saminani. Using the case of our patient, we'll explore how to differentiate different transfusion-related complications. Our patient was a 21-year-old with sickle cell disease admitted for a vaso-occlusive crisis initially, which had since subsided. She developed line-associated bacteremia during her stay, which led to worsening hemolysis, anemia, hypoxia, and troponin elevation with ST depressions on ECG consistent with non-STEMI. In consultation with hematology, 3 units of blood were ordered as management of her hypoxia and non-STEMI. She tolerated the first 2 units well, but during her third unit had worsening oxygen requirements and became febrile. The transfusion was held for suspected reaction, and her blood pressure was 102/69. A stat chest X-ray showed diffuse pulmonary edema, ECG had no acute or dynamic changes, and bedside echocardiogram showed no evidence of systolic dysfunction. At this point, it was unclear whether she developed TRALI or TACO, and there are a few key differences between the two. TACO is similar in etiology and management as congestive heart failure. These patients respond to diuresis as a result and often have an elevated BNP. Conversely, TRALI is similar to acute respiratory distress syndrome. These patients do not respond to diuresis, often require mechanical ventilation, and there is a neutrophil activation mechanism. It can also be associated with hypotension, fever, and leukopenia. In our patient's case, she did not respond to 2 doses of intravenous furosemide, and with worsening desaturations required transfer to critical care for intubation and ventilation. The timing of her hypoxia in proximity to transfusion, lack of response to diuresis, fever, hypotension, and non-elevated PNP all suggested non-cardiogenic pulmonary edema secondary to TRALI. She improved with mechanical ventilation and was extubated a week later. It's important to note the complexity that arises in treating sickle cell patients with hypoxia. Because transfusion is part of the treatment, but transfusion-related complications can worsen hypoxia themselves. Knowing how to differentiate TACO and TRALI is also different because early critical care involvement is crucial for TRALI patients. While TACO is more common overall, TRALI is the most common cause of transfusion-related fatality. Thank you very much for your time, and I would like to thank the Division of General Internal Medicine and my supervisor, Dr. Shazia Saminani.